Mr. Chairman, Honorable Professor Zeng Guohua, dear moderators, Professor Gao Xiaofu, Professor Li Jianxing, professors, distinguished members of IAU, Honorable colleague and of urology, good afternoon. I'm really glad to attend this meeting, and thank you for giving me the opportunity to give my presentation here. And my topic is, when is the best time to perform EPVL after IIS? I'm Changbao and Xiaofu Wang from the second affiliated hospital of Changbao University, Henan Province, made in China. As we all know, nowadays the flexible ureteroscopy lithotripsy is more and more being used in China and all over the world. It is a routine operation of urology. IIS has been increasingly used in the treatment of urolithiasis because it is relatively safe and non-invasive method. Following the increased usage and understanding of IIS, the suggested limits on the diameter of stones eligible for IIS was increased from less than 2 to less than 3 centimeters. The last speaker, they even do the stones bigger than 5 centimeters, right? It is a miracle, maybe. However, we can't guarantee the stone-free rate after IIS. Even the surgical procedure is ideal, while the stone extraction is not. There are still residual stones 1 to 3 months after operation. So discharging residual fragments becomes the biggest problem. Stone fragments left behind could be a disaster sometimes. So how can we get rid of the residual fragments after IIS? To be honest, urologists and patients are hungry for technology to clear these fragments while they are small. Regardless of the location of the preoperative stones, ultimately, more or less, the fragments will go down and go into the lower calyx after operation. However, the lower pole stones seems to be more difficult to be discharged. The traditional methods, such as the passive lysacable, including drink much more water, inversion, doing more physical activities, medical expulsive therapy, and so on, have been reported. But the common methods are not very effective, and the other methods, such as inversion percussion therapy, including diuresis, inversion, vibration, elimination, these methods have not been proven effective or safe either. In China, from 2012, we invented a machine, the external physical vibration lithography system. The machine was invented and developed by our team. This is Changbao University and a company in China. The EPVL has been used in active lysacable for more than 13 years, and we were put into use in more than 600 hospitals. These pictures show that the general 2nd, and the 3rd generation EPVL machine. Preceding studies and our previous research have shown that EPVL treatment can effectively promote the discharge of residual stones after IIS and USWL. And EPVL can shorten the time to stone discharge, increase the short-free rate. And the EPVL is especially effective for residual stones in the lower calyx. Compared with traditional method for discharging stones. In some related studies, researchers usually perform EPVL 3 or 7 days after IIS. However, the time that will achieve the best post-operative results with the fewest complications remains to unknown. So, when is the best time? To answer this question, we designed the research. This is a multi-center study based on randomized controlled trials. We published our article in Eurolysis last year. This RCT was put into practice in 6 hospitals located in different parts of China, such as Zhengzhou, Nanjing, Wuhan, Guangzhou, Huzhou, and so on. The study, multi-center RCT, lasted from March 2017 to August 2017. And totally 176 patients were divided into 4 groups. Group A received EPVL 3 days after IIS, Group B 7 days, Group C 14. Group D as a control group didn't receive EPVL at all. We used the generation 2, the second generation machine. It works like this. We have a bed which can be changed into different directions, so the patient can be kept into different position. Then the horizontal vibrator shakes, and the students goes into the pelvic. Then another vibrator. It is totally free. We can see the light cycle, and the students goes down here, and we can change the position of the patient. Then the students goes out of the patient collecting system. Follow-up examinations were performed on all participants. The result, including student-free rate, student size and location, and complications, were compared among the groups. This table shows the demographic and clinical characteristics such as gender, BMI, student composition, hydronephrosis, student location, and so on. We can see all of the data are comparable among the 4 groups. And this table shows 1 week later, after the IRS student-free rate in Group A was 60%. It is the highest, and the Group B higher, Group C a little bit high, and Group D is normal. All of the Group A, B, C are higher than the Group D. The side effects are of no difference. And this table shows the 2 weeks after IRS student free rate. As time goes by, it rose up. In Group A, it's reached to 80%. It's the highest, and Group B higher. Group C is a little bit high, and Group D is normal. In this table, we can see the comparing outcomes 4 weeks after IIS between the 4 groups. Student-free rate reached to 91% in Group A, which is the highest, and Group B more than 80%, and C is better. All of the 3 groups are better than the natural discharging group, the Group D. And the side effect, hematuria, urine WBC rise, have a little different among the different groups. Let's see the detail. Student-free in different locations. The upper calyx, middle one is of no difference, but the middle calyx, lower calyx, and the renal pelvis, especially the lower calyx, multiple locations. We can see the Group A, B, C, who accepted the EPVL is much higher than the natural group, the Group D. So let's summarize the result. 176 patients in total. The student-free rate in groups A, B, C, and D. With the time went by, the student-free rate is rose up. And in all time point, Group A is the highest student-free rate, and the Group D is the lowest. Group A had 3 days after IIS EPVL had the highest stone-free rate from 7 to 28 days, and Group C had a higher stone-free rate at 4 weeks after IIS than Group D. The side effects were not worse, and it is comparable. So let's make the conclusion. Based on our study, we conclude that the best time to perform EPVL is 3 days after IIS, maintaining a high stone-free rate at any point in time and reduce complications. In the long run, performing EPVL 7 days after IIS can achieve a high stone-free rate and reduce complications as same as performing EPVL 3 days after IIS. EPVL is an excellent method for the residual stones after IIS. Nevertheless, there are some limitations to our study. First, the follow-up examinations were performed not long enough, and the long-term side effects not then more data are needed to verify the results of this study. That's all. Thank you very much for your kind attention.